because, you know, in healthcare, things are always changing, um, and things are, standards are changing, things like that. So it's hard to speak like, oh, unless that's like your area of expertise. A lot of stuff, you got to go and look up, but at least I can help them with like the tools, and the language. And so that's what I've been trying to do too on my blog is, um, you know, help people to speak the language of, healthcare and be able to understand it so that you can advocate for yourself because you are the best advocator. Like, your body, and the best relationship with a provider is going to be one where you're both valued and listened to. And so, if you come in and you start yelling at your provider because, the 10 providers before didn't diagnose you with something, that's not going to open up a good relationship either. And yeah, you can be frustrated and stuff, but like when you take that out on your provider, they're going to be like, oh, geez, like I don't want to see that person. Right. Because they're also a person too, and they're dealing with all the stuff that they're dealing with, and I think when we put people in pedestals, we forget that they're not a god. They are a person. Like they have childcare issues. They get sick. They have, family members they're probably caring for. Um, they got bills to pay and all that kind of stuff. And so, if you're able to both, work collaboratively and in a holistic manner, because like I said, health is not just, oh, you weigh perfect amount, your blood pressure is good, and, you're taking your medications when you're supposed to, right? Like health is a spectrum, right? And it's your mental health, it's your physical health. It's you being able to age gracefully and live in your house for as long as you want. It's you being able to be there for milestones for your kids or nieces and nephews, your grandkids, whatever. It's you being able to wipe yourself, right? Because we see a lot of times people have had a stroke or some other incident like that. Um, Sometimes they can't do that, and it's very humbling to have somebody else do that for you. And most people don't don't want somebody else to do that for them, right? We want to be able to tie our own shoes. We want our independence, and so also finding out what's really important to your patient. So, like, you know, I see a lot of patients that are smokers, right? And a lot of them have been smoking for majority of their life, right? And, we're always asking them, like, "Do you wanna quit smoking?" And a lot of times they're like, "Rah, rah, rah, rah." But, sometimes find out, like, what their motivation is, or, like, what's important to them. And maybe they're like, "Well, I wanna be able to be here for my grandkids," or whatever. And so then you're like, "Okay, well, with you having this 50-year pack history of smoking, that's
That's a
decreasing your
that's a
odds."
lot of smoking.
Well, yeah, 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 and I see that a lot, all the t I mean, because it's you multiply the packs that they do per day times how many years they smoked, and a lot of people started smoking when they were, like, 10, 11,
Yeah.
12, before the
What the
legal
brand
age.
is, some brands are worse than others, I'm guessing.
I think they're all pretty bad. So, and if maybe we can have a conversation and you can start cutting back, because that every little bit helps, and I think that's too, we always wanna jump from, like, from this to this, right? Like, no, no smoking, and for some people, maybe that's what they need to do, but maybe they need a process to get there, and with like health goals, we say we want to lose 30 pounds in 20 days. That's what we said earlier, or 2 months. And that's not really realistic, not in a healthy
Unless you
way.
wanna start smoking crack and fentanyl, something like
Right,
that.
right. You could probably do it then, but I don't think you're gonna make it to your reunion or
No,
whatever.
not
Uh,
recommended at
right,
all.
not recommended. And even if you were able to lose that, you're probably miserable,
Yeah.
and then you're gonna gain it right back, right? And so if we want to do sustainable things, and that's something I try to share, especially um, in my blog and with the women that I work with that making small sustainable changes. Like I can help, like, let's look at your schedule. Let's see, I saw a patient a few weeks back whose husband was deployed, she's a veteran, and two two kids under no, three kids under three. So I think they had a set of twins and then a younger one. Yeah. So I was like, "Oh, you got a handful," and she wanted to start losing weight and stuff. And I told her, and shared to her from like, I'm a mom too, I'm a student, this and that. Just making small changes. Sometimes, as like, especially for you have been active duty, you might not, you want to get back to the gym or you want to get, but like, let's start where you're at now.